It's now my honor and my absolute pleasure to introduce Dr. Lloyd Minor, Dean of the Stanford University School of Medicine. Thank you, Dean Minor, for sharing remarks to round out what has been an incredible morning program before we break for lunch. Dean Minor has shown extraordinary leadership in proposing a transformative new vision for precision mental health. Under his leadership, Stanford Medicine is going beyond precision medicine and embarking on a fundamental shift to more proactive and personalized healthcare that empowers people to lead healthier lives. Join me in welcoming Dean Minor to the podium.
Well, thank you very much, Dr. Williams, and welcome everyone. It's good to see everyone here today, and also definitely want to extend a warm welcome to Dr. Mayberg for joining us from Mount Sinai and sharing her exciting work with all of us here at Stanford today. This is, I note, the third symposium of the Center for Precision Mental Health and Wellness, and I think every year, we continue to see more activity, more engagement from the broad Stanford community on this important topic of mental health and wellness. I don't need to tell anyone in this room that we're challenged today. We're challenged in terms of our overall health and wellness, and certainly we're challenged given the world we live in and a lot of other factors. We're challenged with maintaining our mental and behavioral health. And also, I don't need to tell anyone in this room that whereas we have made great strides in understanding and in treating and in preventing diseases like cardiovascular disease, cancer, and we're starting to make progress in degenerative neurological diseases, we still have a long way to go in terms of understanding the determinants of mental health and well-being, and in also treating mental health diseases and illnesses when they occur. In fact, we still haven't overcome the stigma that has historically been associated with mental health challenges, with what we have in the past described as mental illness. And yet, as we learn more and more, what we learn is that we shouldn't be thinking, fundamentally, we shouldn't be thinking of problems and challenges in mental health and well-being as being fundamentally any different in terms of the approach required to understand and treat them than we have deployed in other areas of medicine and healthcare. First, taking that attitude will hopefully help to overcome some of the stigma associated with mental illness. And second, through the work that Dr. Williams and many of you in this room are doing, it will help to bring the very best science to understanding the determinants of mental health and well-being and to understanding the causes of mental illness. And second, this wave of scientific discovery that has improved our ability to diagnose and in many cases prevent or diagnose much earlier diseases of the cardiovascular system, cancer, other diseases. This wave of science should also, and is thanks to all of your work, being applied to understanding the functioning of the nervous system and how those underlying physiological, biochemical, cellular mechanisms determine and have an impact on mental health and well-being. There's still a lot of work to be done, and I don't need to tell any of you that. But through your passion and your dedication and your commitment, I know that we will continue to make great strides, and that in the future, we'll be better able to serve the needs of our individual patients and of our overall society. And I can't think of a bigger impact set of issues and challenges to address than those that you're addressing in this conference. So thank you all for being here. I hope that the rest of the sessions are as informative and engaging as the morning session. And I wish you the very best in your endeavors. And I also, again, want to thank Dr. Williams and Dr. Ruth O'Hara for all the work that they've done in making this center so successful. Thank you.
Thank you so much, Dean Minor, for those inspiring and motivating remarks. We really appreciate them. And as many of you know, the center was made possible in 2018 because of Dean Minor's support. So I thank you very much for that. Now we will have lunch. So enjoy, have a chance